Here to talk to us more about her appointment and plans for the department, we have with us on the line DOH Officer in Charge, Maria Rosario Vergeire. Yusek Vergeire, welcome to The Big Story. And we should say congratulations on your appointment.
Good evening po, sir. Magandang gabi po sa inyo lahat.
Ma'am, let's start with, well, people of course have been waiting for this appointment. It's one of the, one of the dissonant things that people have noted in the first weeks of the Marcos administration, identifying the public health situation as a crisis. And yet it has taken this long, and in fact still longer, for us to wait for a permanent Secretary of Health. At least on the level of being OIC, what are the marching orders from President Marcos?
Well, specifically, he said that we should be able to improve the coverage in our vaccination. Although we have already achieved almost 71 million fully vaccinated Filipinos, we are still very much wanting as to the booster doses of our population. So that was first of the marching orders. And of course, focusing on the vulnerable population. He noted of these different areas in the country where there are these laggers in our regions focusing on senior citizens. And we need to ramp up our vaccination among our senior citizen population. The second would be, of course, the COVID-19 response. We need to find a way to continue on and sustain what we have done before so that we can be able to prevent further transmission, strengthening our monitoring and surveillance systems, and also we need to be able to prevent that our healthcare system will be overwhelmed if there would be this kind of situation that the cases will continue to increase. Another one would be the healthcare workers, that he would want our healthcare workers' benefits to be provided to them, that we would be able to look into the plight of our healthcare workers in the different facilities of the country.
Yusek, obviously leadership, as we said, of the DOH is something that people have been asking for, looking forward to, hoping for, and speculating on. Could you give us an idea of what are some key policy and leadership and direction matters that can now be more possible and facilitated by having an OIC relative to not having an OIC? And for that matter, what are the remaining gaps between having an OIC and a permanent Secretary of Health?
First and foremost, having an OIC would really have that kind of head among the different units of the Department of Health. Although we were already managing, as we have retained career officials in the DOH, but will always be different if there would be an OIC. We can now be able to do our policy directions. The second would be we'll be able to manage all of these transactions that had been in process before, and we needed an OIC to further negotiate and do these processes. The third one would be, of course, the leadership should be looked up. The different units are expecting that there would be a head to lead the department, and this means a lot to our personnel, that there would be somebody who can lead them and who can guide them and manage all of our processes. So this, I think, would be the advantages of having an OIC. Now, as to the difference between an OIC and a permanent secretary, I guess there is not much difference. I think it's just the appointment. But of course, there would be some matters that has to be referred still to the Office of the President, being that there is this OIC designation still for the head of the DOH.
Yusek Vergeire, in our report a while ago, a lot of good words for you. Your appointment as OIC, keywords: public trust, competence, integrity, and you've been with the Department of Health for quite some time, if I believe 2015. What can we expect from you if you were to be appointed as a DOH Secretary? And outside of the COVID-19 pandemic, what would be some projects that you'd like to divert resources to?
First, I've been with the Department of Health since 2007. And I thank people and my colleagues for all of the trust that is being given to me. What would be our priorities now to divert other resources? First and foremost, we'd like to check First, the plight of our healthcare workers. That would be first on my list. The second would be, of course, our facilities. And by doing all of this, we'll be able to achieve the different objectives of universal healthcare. So at the end of the day, we're looking at providing this universal healthcare to all of our citizens. So we need to just continue on with what we are doing. Not much difference because we just continue to work, and we have already started the different work that we have done for DOH. We will continue on that. But of course, there would be more strategies that we will be implementing so that we can better the health of every Filipino.
Yusek Vergeire, follow up ko lang po dun sa isang tanong kanina. As you said, I mean, you still have enough authority and power. But just one specific thing, when it comes, for example, to other appointments within the entire bureaucracy of the DOH, other agencies attached to the department, will the OIC have power over that and authority for that? Or do we have to wait for an official, a permanent appointment?
Well, that is yet to be discussed with the Office of the President. But for now, I'll be managing the whole of DOH, including the attached agencies of the government of the DOH, like FDA, PhilHealth, and the others. As to the appointments, as to who would be heading the specific units of attached agencies of DOH, it will be up to the Office of the President, because the Office of the President is the one designating and appointing these specific leaders in the attached agencies.
Okay, maraming salamat po. That was DOH Undersecretary Maria Rosario Vergeire. She has been appointed for now as OIC of the Health Department.
Maraming salamat po.